somebody unless you're going to touch their food. For example, you're in the dining room and they've got toast. And the patient says, could you butter my toast? Oh yeah, how are you going to do that with a knife and a fork? No. So you always have a pair of gloves in your pocket. You reach them, put them on, and you butter their toast. And you give it to them however they want. My rule is once you put gloves on to help the patient, leave the gloves on. Because chances are they're going to want you to handle other food too. And it's awkward to take the gloves off, go over and wash your hands, come back. It just doesn't work. So if you're going to use gloves because you have to touch their food, then keep them on. Some people only put one glove on. That's not such a good idea. You need to put two. If you're going to wear gloves, wear gloves. Make sure you wash your hands when you work in a dining room or anything with patients, because you're bringing lots of germs in and you want to make sure that that's nice and clean. Okay, for mouth care. Mouth care is very similar to feeding. We do a lot of similar things. So what you're going to do over in the supply closet, or they're going to have a shelf with supplies, you'll see what's called an emesis basin, and that's this little thing. A toothbrush, there'll be a cup, and toothpaste. You're going to have to get gloves, and you're going to have to get the clothing protector, because for this you do. Okay, so I've gathered that and I put it here, and now I come back to her, and hi, Ms. Smith, my name's Nancy. I'm your CNA today, and we're going to get you up and brush your teeth. So before I get started, let me go wash my hands, close that curtain, lock and load the bed. You've got the call light. Let's get started. So before I do anything, I'm going to sit you up. So on the count of 3, I'm going to have you sit up on the side of the bed. 1, 2, 3. Feet flat on the floor. Anytime you get a patient up, you always say, feet flat on the floor. Can I borrow that chair right there, please? Perfect. You don't want to stand over them. Don't mind me. I mean, that's pretty rude. You don't want to sit on the bed, so get a chair so that you're equal to them. Okay, so this one, we put a clothing protector on. This is to protect your clothes. And I'm going to slide this, and you can put your feet right there. And again, it's convenient for me to do it up here maybe, but that's not very nice. Now, would I wear gloves? You betcha. Could you put like an inch of water in there, cold water? So I would have gotten water and put that in there. Make sure I do this right. You guys have your little book. Now, I take the toothbrush out. Once I take the toothbrush out of its container, this plastic sheet, I do not let go of this toothbrush until I'm done. So, first thing I do is I dip it in the water, and then I put some toothpaste on it. There's very little toothpaste on that. Oops. Okay. You don't want a lot because you don't want them foaming at the mouth. Now, you can say to her, would you like a sip of water before we start? And she can say yes or no. Would you like a sip of water before we start? Okay. So, I'm going to have you open your mouth. I'm going to do top inside, top inside, top outside, bottom inside, bottom outside. Now, could you stick out your tongue? Great. Could you spit, please? Okay. Do you want a sip of water?
Yes, please.
Are you ready?
Yes.
Okay. Notice I've got the toothbrush. I don't set it down. This is critical. Do not set this down. She's done. That was lovely. Let me wipe your mouth. Thank you. You take this. You go, if you want to hop back in bed and cover yourself up, that's lovely. I take all these things, and I need you